Hi, my name is Tatiana McNeil, and I'm here to talk about how premenstrual dysphoric disorder affects many females across the world. Well, let's start with the basics. A menstrual cycle is a hormonal process that a woman's body goes through each month in order to prepare for a possible pregnancy. This is what is commonly known as a period or a cycle. Prior to the onset of that cycle, or sometimes even during, women can experience many uncomfortable symptoms, such as headaches, menstrual cramps, nausea, and even vomiting. However, in more extreme cases, women can experience what is known as premenstrual dysphoric disorder. Imagine all those previous symptoms I mentioned on a magnified scale. Well, let's break it down even further. Premenstrual dysphoric disorder, or PMDD, is a severe form of premenstrual syndrome. The symptoms usually begin to manifest in the final week before the onset of menses, start to improve within a few days after the onset, and become minimal or absent in the week post-menses. This disorder is characterized by several symptoms, such as the following: mood disturbance, reactivity or irritability, depressive mood, anxiety or tension, and decreased interest in usual activities, such as work, school, friends, or hobbies. Difficulty concentrating, easy onset feeling of fatigue, a change in appetite, hypersomnia or insomnia, and physical symptoms such as breast tenderness, swelling, joint or muscle pain, or weight gain. So, here are the facts. About 5% of women are affected by this disorder. That's about 1 in 20 women, usually occurring in women around the age of 20, with the possibility of the symptoms worsening over time. In fact, premenstrual dysphoric disorder is not specific to any culture and is actually found in many different countries across the globe, including the United States, Asia, Europe, and India. Well, you're probably wondering, can PMDD be treated? Yes, it can. There are many different forms of treatment for premenstrual dysphoric disorder, so find the one that best fits you. Some milder forms of treatment include different therapies and dietary changes, such as a monthly mood chart, which can be both informative and therapeutic, by helping women to anticipate the days that they feel more at risk to their symptoms. Nutritional supplements, such as calcium and vitamin B, that significantly reduce physical and emotional symptoms. And cognitive behavioral therapy, or CBT, a form of psychotherapy that has been proven to reduce premenstrual symptoms. Or, in other cases, pharmaceutical drugs can be prescribed by a doctor, such as selective serotonin reuptake inhibitors, also known as SSRIs, a class of drug typically used in treatment of depressive and anxiety disorders. Benzodiazepines, often used to reduce anxiety and other related symptoms. And even oral contraceptives to intervene with hormones related to ovulation, resulting in the elimination of their premenstrual symptoms. The important thing to remember is that you are not alone. If you feel that you have connected to this video or know someone who may be experiencing these symptoms, please seek help. Feel free to contact the Gable Health Center located on campus to schedule an appointment. It's free.
Created using Powtoon.